Hello, this is Brian Casey, Editor-in-Chief of AntMini.com, and we're here at the 2015 edition of the RSNA meeting in Chicago. We have with us right now Dr. Geraldine McGinty of Weill Cornell Medicine, and we're going to be talking about the coming value-based healthcare environment and how that's going to be changing for radiology and how radiologists can prepare for that. Dr. McGinty, thanks for being with us.
Thank you, Brian.
So can you talk a little bit about what's changing in radiology? We've had this fee-for-service model that's served everybody pretty well for a long time, but our understanding is that that's going to be going away very soon.
Well, I wouldn't say fee-for-service is going away, but it's certainly going to be changing. And you know, we've been talking about Imaging 3.0 probably for about 3 years now, and we always said that it was three things. It was culture change, it was informatics tools, and it was payment policy. It was shaping payment policy to support the kinds of activities that we were encouraging radiologists to start even before the payment policy caught up. So that's connecting more effectively with our patients. It's becoming embedded and becoming an essential part of the clinical care team. So I'm delighted now that we've seen with the passage of the macro legislation, and we don't have to worry about the acronyms, but just know that what that does is it stabilizes Medicare payments for about 5 years.
And this is the legislation that replaced the SGR, correct?
That's correct, Brian,
Okay.
Yes. So that legislation means that the transition towards value-based payments is going to be accelerated. By 2022, a radiologist participating in fee-for-service will see about 9% of their Medicare payments at risk for quality or value-based activity. So it really is becoming a significant part of the payment system.
Now, what are some things that are being done at places like the American College of Radiology, which you're involved with, to prepare the specialty for this this value-based environment?
Absolutely. We want to make sure that radiologists are participating to the fullest extent, because we know we have a lot of value to deliver, and we want to make sure that that's recognized and incentivized. So as soon as the legislation passed, we put together a work group, and my work at the college is in economics, but so much of what we need to do to fully engage with these programs involves quality and safety, involves informatics, and our new patient and family-centered care commission. So we brought all of those stakeholders together. We spent the summer doing some internal education, because I might be familiar with economics, but I'm not necessarily familiar with how our metrics are developed by our quality and safety team. So a lot of internal education. And then the other thing is we felt like it was important to take the pulse of our membership, see where people are in terms of these new payment models. And no surprise, most people are still in a fee-for-service environment. So that, I think, set the stage for us to know that we need to really support the membership making this transition.
Now, when you talk about new payment models, is that something that we're going to be given by the federal government, or is that something that people are kind of on their own to develop?
Possibly both. I mean, I think when most people think about alternative or new payment models, they think about concepts like the Accountable Care Organization, essentially one of the flagships of the Affordable Care Act. And certainly that was established by the federal government, but we're seeing similar type arrangements established with commercial payers. We're seeing groups setting those up even in their own health system. So I think it's going to be a mixed bag, but I think essentially the main impetus is probably going to come through the Medicare program, which is what happens with most payment policy.
Yeah. Now, we're talking about a really big shift in mindset here, going from fee-for-service to value. Do you feel like most radiologists and radiology facilities are ready for that?
Well, I think it's going to be on a curve, obviously, and I know that for a lot of radiologists who've been dealing with the kind of reimbursement cuts that we've been challenged with over the last few years, that thinking about how to add activities around value can seem very challenging. That's why we've established our case study library to show real radiologists making this kind of change in different ways. There are definitely people who are further along in the curve, and we're using their stories to inspire those who might not be so far along.
Okay. What sort of advice would you have for radiologists and imaging facilities about how to prepare for this environment and how they can educate themselves?
Well, we do have some great materials available. The one that I think if you really want to understand what these new payment incentives and payment models mean, my colleagues Zeke Silva and Greg Nicola did a phenomenal webinar which explains every acronym, makes it really clear, and that's available on the ACR website. That's a great place to start.
Okay, great. Any other advice?
Well, we were very fortunate to receive a $3 million grant from the Centers for Medicare and Medicaid Innovation for a program that we're calling RSCAN. And what it does essentially is it allows radiologists to engage with their referring physician community on what it means to image more appropriately. And that's a great way to start talking about value and talking about imaging appropriateness with your referring physician community.
All right, good. Great advice. Thanks for being with us today.
Thank you, Brian.
Signing off for AntMini.com, my name is Brian Casey.